Okay, now for more on the UN COVID session, I'm joined via Skype by science and health journalist Tara Haelle. Welcome to the show, Haelle. Thanks very much. Or Tara, thank you very much for taking time to chat with us. Look, we have a lot to get to. I want to start by asking you what you're hearing. Why did it take so long for the United Nations to hold a pandemic summit? And explain how this global forum is really different than, say, a G20 session or something like that.
Absolutely. I can't give you a good reason on why it took so long, except that I think everybody was scrambling so much at the start, and I don't think there was adequate preparation for a pandemic of this size that's been discussed for many years, that the world was not prepared for it. And I think so many countries were preoccupied with taking care of their own countries that the priority for getting together as a global community just got sloughed to the side, unfortunately. I'm glad that they are meeting now, but I do think that some of the criticism for not doing it sooner is justified. In terms of its difference from the G20 summit, with G20, you've got 20 of the most powerful countries in the nation discussing it, and that's great if they're able to discuss how they can also help out the other nations in the world, but they're still going to be focused primarily on their resources and their needs and their cooperation, whereas the WHO meeting has an opportunity to make sure that none of the other countries are left behind. We've got over 180 countries on this planet. We want to make sure that equitable distribution of the vaccine and equitably addressing the public health emergency is essential because we are a global community.
Yeah, I want to get to that and the nationalism that comes to play in this in just a bit, but let's talk about what the UN Secretary General had to say. He was especially critical of nations that have not been embracing science, involved in slowing the pandemic. And he didn't name names, but look, at the top of the list is the United States. It seems that this is a glaring problem for the U.S. What are you hearing from your other sources? How much has this hurt the global-wide pandemic problem?
I think it has had a tremendously horrible effect. We have the largest number of infections. Just today, 2,800 people died in a single day. The United States has always been a global leader in public health. The WHO's budget is only $5.8 billion each year, or every 2 years. Where CDC alone is $11 billion per year. So the CDC is more than 4 times the money to deal with this and has outposts all across the world for dealing with the pandemic. What our pandemic preparedness plans did not account for was an anti-science. I hesitate to call the United States president a leader because he has done none of that. There's no leading. He has denied the science, and he has made much worse an already dire situation. That means that the United States cannot help themselves, and they also can't help others. And then we have, our policy influences many of the other nations across the world. And if people are following our example, they're going to end up with the horrible numbers that we have.
And let's talk about what China, Wang Yi, had to say. It's going to play an active role. And today, Wang Yi talking about how China wants to develop its vaccine and get it out to developing nations. Is that the thing that you think needs to come out of this? There needs to be a plan, and there needs to be a way to help those countries in most dire need.
What I think needs to happen is there needs to be a working group that comes together and first determines what are the priorities, what needs to happen. Is it preventing death where most death is occurring? Is it preventing transmission across borders? Is it reducing long-term effects? Those are all different goals, and they're going to have different vaccination goals. So until you know what your actual public health goal is as an overall priority, you can't make decisions about priority and where those different vaccines go. Once you have those goals stated, you can look at plans to do that. Okay, so does that mean that we give more vaccines to this part of this country, and then we focus on this population within that country? That's why healthcare workers have been prioritized, because it can reduce death and it can ensure that there are more people available to help those who are getting sick.
I'm sorry.
Sorry, go ahead.
And a huge question is going to be how the vaccines will be rolled out. We talked a bit about it. What role do you think the United Nations will have in, and is there a realistic concern about vaccine nationalism?
I think both of those are, it's definitely a legitimate concern about vaccine nationalism. And again, our president has not helped that, although fortunately there are companies that recognize that need. It doesn't do the United States or France or, Australia any good if they're all vaccinated, if their own citizens then travel throughout the world and people come to travel those countries. I mean, we need global immunization. One of the initiatives that the WHO is doing, they're working with Gavi, the Global
Mm.
Alliance for Vaccines and Immunization, to develop COVAX. That is about 2/3 of the countries are involved in that. And what it is that all the countries, it's sort of they give what they can give to participate in it. And then COVAX is investing in 12 different leading vaccine candidates. And as those become available, they become distributed equally among all of the members. It'd be nice if that was true across the world. And I don't know if it's proportional to population or if it's just equally division. I don't know the details of it. But I think we do need to invest a lot of energy and budget into, that incentive
Absolutely.
like it to ensure that we have equitable distribution.